So I studied the mechanisms that underlie vascular disease in the labs of Dr. Klarin and Dr. Leeper. So we use kind of basic science tools to study how our genetics plays a role in the development of cardiovascular disease. I always was interested in genetics, genomics, and understanding how that mechanistically makes us prone to developing different types of diseases, and I always knew that I wanted to kind of go down that route. I did a PhD during med school and studied kind of the way in which we develop arthritis, and I wanted to, after joining the vascular surgery residency, kind of get a good solid foundation in vascular biology in the labs of Nick Leeper and Dr. Klarin. So Stanford has multiple funding mechanisms during the professional development time. The T32 program at Stanford is pretty large, and there are multiple T32s within various divisions. I'm on the T32 that relates to vascular innovations, and I applied for that during my third year of residency and got it. So that's what's funding me right now. There are other mechanisms like the R38, and then others can find kind of their own funding through other sources as well. These 2 years of research had a very solid foundation for me in terms of being able to kind of succeed as a surgeon scientist. I'm planning to write career development awards to fund future research efforts after graduating. So I would say start early, thinking about what you want to do, start meeting with faculty, and kind of figure out a plan for what you're going to do when you start your PD time. The earlier you start thinking about it, I think the more success you're likely to have, because you're able to kind of hit the ground running as soon as you start, rather than starting to plan as research time starts.